Good morning to all of you, to all of those who make this broadcast possible, to Gisela supporting us from the studio, and to all those who tune in every morning to hear our briefing and who comply with COVID-19 measures. Excuse me while I remove my face mask. Today is a day of celebration in our country. It's the anniversary of the attacks on the Moncada barracks in Santiago de Cuba and Carlos Manuel de Céspedes barracks in Granma, and soon celebrations for the 505th anniversary of the founding of the city of Santiago de Cuba. Now, the COVID-19 situation in Cuba. Today, 261 people are hospitalized in Cuba. 5 are under observation, there are 199 suspected cases, and 57 confirmed active cases. In our primary healthcare system, 328 people continue to be monitored by our professionals and specialists. Yesterday, over 3,000 samples were studied. 3,183 were processed in our various molecular biology laboratories. 1,550 were processed at the Pedro Curi Tropical Medicine Institute, 469 in Havana's Hygiene, Epidemiology and Microbiology Center, 282 in Santiago de Cuba's, 209 in Villa Claras, 321 in the Hermanos Aymajeres Hospital Laboratory, 278 in the Genetic Engineering and Biotechnology Center Lab, and 74 in the Civil Defense Laboratories. Of the 3,183 samples processed, 17 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country thus far to 247,203. Of which 2,495, or 1.01%, have tested positive for the virus. Yesterday, samples were processed from all of the country's provinces, especially Artemisa, the results of which I will announce shortly. The Civil Defense Council is working to control an outbreak recently reported in the municipality of Bauta in this province. Yesterday, 1,771 samples were studied from Artemisa, 1,449 from Havana, 99 from Santiago de Cuba, 63 from Mayabeque, 77 from Ciego de Ávila, and so on and so forth from all of the country's provinces. The 17 positive cases diagnosed yesterday are all Cubans. 14 of the 17 are confirmed case contacts, representing 86.45% of all confirmed cases, or 2,157 people. I always stress the importance of the risk posed to this group and why it is essential that once someone tests positive for the virus or is declared a suspected case, that they let authorities know of everyone they have come into contact with over the last 14 days, because it is most likely that there will be other positive cases within this group. We have been able to trace the source of infection in all of the cases confirmed yesterday, meaning that it has not been possible to determine the source of infection in only 119 people, or 4.8% of all cases. Of the 17 positive cases yesterday, 3 contracted the virus abroad. These individuals recently arrived in Cuba and were sent to an isolation center for the mandatory 14-day quarantine period. Samples were taken from these people, and 3 tested positive for the virus. Of all those that tested positive yesterday, 8 are male, for 50.3% of the total, and 9 are female, representing 49.6%. Only 11 of the 17 cases were asymptomatic, for a total of 1,364 people, or 54.6%, who have been asymptomatic at the time of testing. And if we look at this figure over the last 15 days, it stands at 55.3%. Regarding the age of those who tested positive, one is under 20 years of age. They are 8 years old, bringing the total number of children or patients under 20 to have contracted the virus to 281 in Cuba, of which 277, or 98.6%, have been discharged from hospital and made a full recovery. This is a reflection of the positive response to treatment by this age group. 12 cases are between 20 and 39 years of age, 2 are between 40 and 60 years of age, and another 2 are over the age of 60. I repeat, 1 case is under the age of 20, as I previously mentioned, an 8-year-old child from Bauta. 12 cases are between 20 and 39 years of age, for 70.5%. 2 cases are between 40 and 60 years of age, and 2 cases are over the age of 60. Of the 17 cases confirmed yesterday, 7 are from Havana, including 5 from the municipality of Havana del Este and 2 from La Lisa. 7 are from Artemisa, all from the municipality of Bauta. 1 is from Cienfuegos, there's 1 from Camagüey, and 1 from Ciego de Ávila. All of these are imported cases, to which I made reference at the beginning of this briefing. As I always say, these are people who haven't even arrived in their provinces and are not cases of local transmission, and therefore do not count towards these provinces' confirmed case rate. As such, Cuba's confirmed case per 100,000 inhabitants rate over the last 15 days currently stands at 0.58, higher than yesterday's. Havana has a rate of 1.92, also higher than yesterday's figure. Meanwhile, Artemisa, with a rate of 4.47, currently has the highest in Cuba, a figure which is also superior to yesterday's. Then there is Villa Clara, with 1 recently confirmed case and a rate of 0.13. Of all of the confirmed cases, the cases in Havana, in Artemisa, I would like to point out how these are related to specific outbreaks which are being managed and investigated and which have led to these statistics. The case of Artemisa shows how violating measures and restrictions directly affects the spread and transmission of the virus. I mention this to remind us all to comply with the established measures, to adhere to restrictions related to large gatherings so that we don't see a regression in our COVID-19 response. As such, of the 2,495 patients that have been diagnosed with the virus in Cuba since March 11th, when the pandemic began, 57 are active hospitalized cases, representing 2.2% of the total, all of which are also clinically stable. The patient that had remained in a critical state for several days, and yesterday was reported as being in a serious condition, is now clinically stable. As we always mention, there have been 87 COVID-19 related fatalities in Cuba since the pandemic began. There have been no deaths to report, though, in the last 14 days. Cuba therefore has a mortality rate of 3.48%, which, compared with the regional rate of 3.94%, places Cuba in 21st position in the Americas and 111th in the world, after Montenegro moved up to 110th place. As I always mention, 2 patients were previously evacuated at the start of the pandemic. 4 people were discharged from hospital yesterday from the province of Havana, a discrete number compared with the number of positive cases diagnosed yesterday. This brings patients who have recovered from the virus up to 2,349, or 94.2% of all positive cases. The global outlook, meanwhile, is complex. As of midnight last night, COVID-19 continues to be present in the same 185 countries. There are currently 15,762,053 confirmed COVID-19 cases worldwide, after 284,581 cases were diagnosed yesterday. 6,151 COVID-19 related deaths were reported yesterday, for a total of 639,273 fatalities since the beginning of the pandemic, and a global mortality rate of 4.05%. In the region of the Americas, which accounts for 53.72% of all COVID-19 cases worldwide, 172,081 new cases were reported yesterday, for a total of 8,468,268 COVID-19 cases. Yesterday, 4,152 people died of the virus in the region, for a total of 334,070 COVID-19 related fatalities in the Americas, and a mortality rate of 3.94%. The United States continues to be the country with the highest number of cases, with 4,112,529 and 145,546 fatalities. It's followed by Brazil, India, Russia, South Africa, Mexico, Peru, and Chile. This is the information we have on the behavior of the pandemic in Cuba and the world.